Joel Embiid of the Philadelphia 76ers went down last night with a very scary looking knee injury against the Washington Wizards, and when you watch this one, you can't help but think of the worst. Now, on the actual play that Embiid was injured on, he was going in for a dunk, and as he was landing, we saw that he would land very awkwardly onto his left knee, and his knee would actually go into a position known as hyperextension. And so after the play, he immediately went into the locker room for evaluation. Now, Embiid has been having a great season so far. And so when I saw this injury, I was really hoping for the best, that Embiid would not have anything too serious going on with his knee. And fortunately, today we did get some great news in that Embiid did have his MRI, and as of right now, sources are saying he's dealing with something known as a bone bruise and could miss anywhere between 2 to 3 weeks. Now, although Embiid did not have any structural damage to his knee, the position of knee hyperextension is very risky and can lead to some really serious knee injuries. And so since some people may not be too familiar with that, I'm going to go ahead and focus on that in today's video. Welcome, basketball fans. For those of you that aren't familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with today's video, we're going to look at Joel Embiid's most recent left knee injury against the Washington Wizards. First, I'm going to start off by showing the play that we saw Embiid get injured on so that we get a good visualization for his mechanism of injury. Then I'll go over the anatomy associated with a hyperextended knee and a bone bruise to the knee joint. And finally, I'll go over why this is such a compromising position for the knee and what we should expect moving forward. Now, if you like today's video and you find it informative, please hit that thumbs up and subscribe to the channel, because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the section below. Now to begin, let's take a look at the specific play that Embiid was injured on. Here we see Embiid runs the pick and roll. He gets the ball, goes in for the dunk, lands very awkwardly, and as he does this, he's in noticeable pain and remains on the floor. In slow motion replay, we see as he goes in for the dunk, he lands right here, and that left knee goes into something known as hyperextension. Now here I have a model of the knee joint, and so we see two major bones that will come together at the knee, and they are the femur, or the bone that we often associate with the thigh, and then the tibia, which is below that, which is the bone that we often associate with the shin. And so with the knee joint, there are four major ligaments that contribute to overall stability at the knee. And the first ligament, the one that we often hear about, is the anterior cruciate ligament, or the ACL for short, which is located right in through here. Then we have the medial collateral ligament, or the MCL for short, and that's located on the inside or the medial portion of the knee, and you can see that right there. Then as we move on to the outside or the lateral portion of the knee, this is a ligament known as the lateral collateral ligament, or the LCL for short. And finally, the last major ligament that contributes to overall knee stability is one known as the posterior cruciate ligament, or the PCL for short, and that is located right in through here. Now, if you've watched any of my prior videos, you know that there are also two other major structures located within the knee, and they are the medial and the lateral meniscus. And you can think of these structures as shock absorbers between the femur and tibia bones. Without them there, or if there is any specific damage to the meniscus, then that can create some bone-on-bone friction, which oftentimes creates pain. Now, I'll go over the typical movement pattern of the knee. And so the first one is known as knee flexion, and this is when a person is going to be bending their knee. And then the other movement at the knee is known as knee extension, and this is when a person is going to be straightening their knee. And there are some norm values for flexion and extension. Typically, flexion can range anywhere between 130 to 140 degrees of that flexion. This is going to depend on the size of the leg and specifically the size of the thigh as well. But generally speaking, extension, you're going to have 0 degrees. So when a person is in fact in that straight line, that is going to be considered a norm value. In personal practice, I've seen where a person can go beyond 0 degrees, but typically speaking, the norm value for extension is 0 degrees. Now, when a person extends further beyond that norm value of 0 degrees, or whatever the norm is for that person, that's something known as hyperextension. And you can see this here, that as we go beyond that typical extension, that starts to stress all of the major ligaments in the knee. So as a person goes into hyperextension, everything is being stressed in that knee. If a person goes into too much of hyperextension, then what can happen is the front of the femur and the tibia can actually make contact with each other. Now, in Embiid's case, thankfully, we know that there is no major structural damage to the knee joint, but as you saw before, that is going to place a lot of stress on all those structures of the knee, including the major ligaments and potentially the meniscus as well. So it's very fortunate that as of this time, all those types of injuries have been ruled out. One other thing that Embiid is very lucky that did not happen on this play is that he was not hit or nobody made contact with him while in that knee hyperextension, because sometimes if someone goes into hyperextension, the knee is already very vulnerable. But if somebody hits them from a specific angle, so for example, if they get an impact from the outside, that can further stress one or more of these ligaments as well. So there are many things that Embiid was very lucky on with this injury, and another one that is really, really fortunate is the fact that no one actually made contact with him while in that position. Now, generally speaking, when somebody is going into that hyperextended knee position, oftentimes afterwards they're going to experience pain, swelling, and potentially bruising to the affected areas. Now, Embiid has been diagnosed with something known as a bone bruise, and so oftentimes we associate bruises with that discoloration we see on our skin, but bruising can also happen to structures such as muscle and bone. When someone does get a bruise, typically what's happening is that the trauma was great enough to cause some damage to those very small blood vessels in the area, and this is exactly what happens at the bone as well. As I showed before, if somebody goes into too much hyperextension like that, it can make contact with those front parts of the femur and of the tibia. Now, it's also really important to know that typically x-rays will not show bone bruising. So the gold standard for this is the MRI. We know Embiid did in fact have the MRI. So this is most likely when they officially diagnosed that bone bruise and of course ruled out all those other major structural injuries. But if a person is dealing with a bone bruise from a knee hyperextension, typically they will deal with it in the anterior portion of that knee joint because that is where it's most oftentimes making contact between the femur and the tibia. Now, I'm just going off speculation because I watched the video. I'm not treating Embiid, and I don't know exactly where that bone bruise is located because it hasn't been released, but speculating based on the video, it would make most sense that he is in fact dealing with the bone bruise in that anterior or front portion of the knee joint. As of right now, according to sources, the 76ers are expecting Embiid to miss potentially anywhere between 2 to 3 weeks with this bone bruise, and usually bone bruises can heal anywhere between a few weeks to a few months depending on the severity. So I think as of right now that they gave him the 2 to 3 week time frame, I think that's a very good sign in Embiid's case, but it's going to be really important that we follow his progress with his follow-up appointments and we just monitor his case moving forward. Typically in therapy, when we see somebody coming in for a bone bruise such as this, within those first few days up to about 7 days, person is going to be in something known as the inflammatory phase. This is when we're going to be very conservative with the person. We see that acronym most often with this known as RICE, R for rest, I for ice, C for compression, E for elevation, because you just want to basically pump out all of that swelling and inflammation within the knee joint and get the person comfortable. Once they're out of the inflammatory phase, then we can start restoring the range of motion to the knee, making sure that the person regains all normal mobility. And as the person is doing this, depending on how they feel, we start to introduce strengthening exercises and then finally sport-specific exercises. So I think as of right now, he's going to be most likely in that conservative care, but depending on how he does, he could bounce back fairly quickly. Once again, I think the fact that they've given him 2 to 3 weeks is a very good sign moving forward. So I'll be monitoring his case closely, but if you happen to see any other news and you want to post it, please go ahead and post that in the comment section. And that's it as of right now regarding Joel Embiid's most recent bone bruise to his left knee. Once again, if you like today's video and you find it informative, please subscribe to the channel because I will be making more videos in the future. Thanks for tuning in, and I'll see you next time.